Make sure you get a deep latch. If your baby can open wide and close his mouth further back on the breast, he will be able to latch deeply onto the nipple, areola, and the breast tissue underneath. Clamping down just on the nipple is not only inefficient for drawing out milk, but can also cause nipple damage and pain. To help your baby get a good latch, place your thumb on the top of your breast and position the other 4 fingers of that hand underneath it. Pull back slightly on the breast tissue toward your chest wall to bring out your nipple. Brush your baby's lips or cheek with your nipple to trigger his natural feeding instincts. Once he opens his mouth very wide, hug him into the breast, aiming your nipple toward the roof of his mouth. When he latches on, his lips should be splayed out. Breastfeed often. Nurse your baby as soon as you can after delivery, and then often after that, so she can practice breastfeeding while your breasts are softer. They will become firmer in a few days when your milk comes in, and this can make a flat or inverted nipple harder to latch onto. Use a breast pump. Right before you feed your baby, briefly pump your breast. A manual hand pump can be convenient. This will make it easier for your baby to latch on by pulling out your nipples and softening your breasts if they are engorged. You might also use a pump regularly between breastfeeding sessions to help draw your nipples out and to stimulate your milk supply as you and your baby learn to breastfeed and work through challenges. You can continue to use a breast pump to help draw out your nipples as long as it is comfortable and effective. Eventually, a pump can help break up tissue adhesions that cause inverted nipples. Try a nipple everter. Designed to help draw out flatter inverted nipples, this product is a device with a flange attached to a bulb. Just before feeding, place the flange over your nipple and squeeze the bulb. The resulting suction gently pulls your nipple out. Use a breast shell. These plastic shells come in 2 pieces, with a hole that fits over the nipple. The shells place gentle pressure on the breast tissue, drawing the nipple through the hole. These can be worn during pregnancy to prepare your nipples for breastfeeding. Don't wear them if you are at risk for premature delivery, because they may cause uterine contractions. Breast shells designed to draw out nipples can also be worn for about 30 to 60 minutes before breastfeeding. Some women wear them between nursing sessions too, building up from an hour a day to about 8 hours a day. To prevent tender spots from developing, do not wear them overnight. Be sure to follow the product manufacturer's guidelines to clean the shells and keep any milk that collects free of bacterial contamination. Some shells are designed to collect milk that you can feed to your baby. Others direct you to dispose of any milk that accumulates in the shells. Try a nipple shield. A silicone shield placed over your nipple can help your baby latch on while allowing milk to flow through holes in the center. Work with a lactation consultant to learn how to use nipple shields safely and effectively. Many women have had success using them for inverted nipples, but some babies are unable to get enough milk using one. This can result in low milk supply, clogged ducts, or mastitis as well as poor weight gain in your baby. Some women are able to draw out their nipples manually, nipple stimulation. Before breastfeeding, try stimulating your nipple by gently rolling it between your index finger and thumb. Then touch your nipple with a cold, wet cloth. Do not leave an icy cloth on your breast for long though, or it might inhibit letdown. This technique is usually more helpful for flat nipples than inverted nipples. Reverse pressure softening. Shortly before nursing, draw out your nipple by placing your fingers around the base of your nipple and push inward toward your chest wall with steady pressure for about 1 minute. Release and repeat, if necessary.